Hey, it's me, Dr. Joffrey. Thank you for joining me. This is going to be Men's Health Month in honor of Father's Day. We're going to be discussing prostate cancer to erectile dysfunction to strokes to cardiovascular issues. Today, we're going to be talking about what a PSA is, prostate-specific antigen, and what are the 7 non-cancerous reasons for a rise in PSA. Just to set it up, a PSA, that's a blood test that's used for screening for men in prostate cancer. And sometimes it's elevated. Today, we're going to talk about the 6 reasons why your PSA may be elevated, the 6 non-cancerous reasons. First of all, a PSA, again, the prostate-specific antigen, it's a protein that's produced in the prostate. The main function is it helps liquefy your sperm. It makes it more mobile, more functional. The next question is, should PSA be in your blood? A little bit of leakage. Just due to normal cellular turnover of your prostate, you may get a little bit of prostate level in your blood, which is why the normal value for having prostate in your blood, the normal range is 0 to 4. Again, 0 to 4. That's considered normal. As a result of the disruption of the prostate barrier, you may get a rise in your PSA level. Now let's get into the 6 reasons why your PSA may be elevated and it's not due to cancer. One of them is called BPH. Many of you all have heard it, benign prostatic hyperplasia. In other words, your prostate just simply gets bigger as you get older, and because it's gotten bigger, your prostate cells are producing more prostate, and so it may rise in your blood. Secondly, is something called prostatitis. Your prostate gets inflamed or infected, and it causes prostate to be pushed into your blood, and your PSA level is elevated. Number 3, if you had any type of manipulation or prostate trauma, it can be from riding a bicycle, riding a horse. When you went for your PSA screening, sometimes, they do a rectal exam where they take their finger, the provider takes their finger, put a little gel on it, and they go through your rectum and feel your prostate. They're feeling for nodules and mass. That will cause a temporary rise in your prostate level. And believe it or not, 4, urinary tract infections. Yes, urinary tract infections can cause a rise in your prostate level. And then, as we just talked about, 5, age. Just as we age, you slowly have slow increases in our PSA levels. For instance, when you were 40, your PSA level may have been 0.4. However, when you're 65, it may be 3.4. That's just a result of aging most of the time. And then finally, ejaculation causes a sudden rise in your prostate level. We just talked about what? The PSA, that protein, it's combined with our sperm to help our sperm become more mobile, to become more liquid. And so when we ejaculate, we may have a rise in our prostate level, and that's usually only for about 48 hours. Those are the top 6 non-cancerous reasons. Now, a rise in your prostate level can also be a sign of prostate cancer. And we're going to talk about that later, but can be a sign of prostate cancer. Here's the point. What's most important, let me land my plane. You should be getting your PSA level checked. You should be getting it checked yearly. If you're over 50, it should be a yearly exam. However, Black males should have it done over 40, or if you have a family history and you're any color, you should have your annual screening exam done yearly. By the way, women, studies show that men who have women connected to them, whether it be a sister, a wife, a mother, who are involved in the men's health, they tend to be more compliant about going in for their annual exam, which would include a PSA level, and if allowed, a digital rectal exam. The reason why I say if allowed, having talked to hundreds of men, that digital rectal exam is what throws people off. So I tell them, hey, if you're not going to do that, the most important part is just getting that getting that PSA level done. Hope you found this video helpful. Again, we have a lot we're going to be talking about as it relates to men. Who's this series for? If you love a man, if you know a man, that's for you. You got a brother, a father, a spouse, an uncle. This video series is for you. It's for them, and we're going to get to it. Thank you very much. I look forward to seeing you on the next video. But most importantly, make sure you grab a mail and say, hey, let's go get you signed up to get your PSA level done. Talk to you soon.